So you've decided that your joint pain is severe enough that we need to move forward with surgery. Now what? Typically what will happen is I want all of my patients to obtain some baseline blood work, and we kind of do that right away because in years past it wouldn't get done until last minute, and then there were things that could have been corrected and we just didn't have the opportunity to correct it. The patient says, my family's here, I want it done anyhow, and so the surgeon is put in an awkward situation of I could have maybe made that patient more optimized for surgery. And so I like to get that blood work really right out of the gate. So my staff is going to help you obtain that blood work. We need to see those numbers, those values, prior to booking an actual surgical date. So that's the first thing that happens. We need to get some blood work. We're going to give you an education book. I want you to read that book. I've got multiple videos. Of course, you're watching one of them now. So I'm going to want you to watch my videos to understand what's involved. And down the road, prior to surgery, you're going to meet with me personally, and we're going to go over any questions you have from that book or from the videos, etc. We'll make a specific treatment plan for you around the entire surgical procedure, what medicines to use, etc. So that'll be the next thing that happens further down the road. We're also going to have you see a therapist one time to go over how to get your house ready, how you're going to use a walker and a cane, and what potential problems that you might run into. Usually most patients need to get an okay from their doctor, sometimes a cardiologist if you've got heart problems. So those are typically things that may occur during this process between now and actually having surgery. Lastly, I generally like to talk about what happens on that surgical day. Currently, with the COVID, many patients and their families are separated. You get dropped off and your families head on home. And in general, it's about 6 hours from being dropped off to being allowed to come in for the last 30 minutes and work with your family member to go over the therapy again, go over the medications and so forth. Sometimes in the hospital it takes a little longer. The hospital has a certain pace. The therapists have to see other patients, so sometimes there's a little more of a delay. And at the surgery center, sometimes it's a little quicker. But in general, from drop off to being ready, about 6 hours, something like that. And there are a number of steps that happen in the facility. So you'll get prepped and draped. Preoperatively, you'll get medications, you have the anesthesia, sometimes special blocks. Then I do the surgery. My part's only about an hour, but all the other hours are getting ready for surgery. Then there's the having the surgery, and then there's the waking up and doing the therapy. So those are the kind of the steps to expect now that you've decided to move forward. So what I need you to do is I need you to read that book. I need you to watch the videos. I need you to prepare yourself for surgery. Write down questions that you can ask me and my staff. No question is too dumb. If you're not sure about it, ask us, right? We've done thousands of these, but for you, this is the first time. So if you got a question, you let us know.